My name is Ihssan T here. I am a graduate nursing student at Jacksonville State University. I am doing a presentation for my epidemiology course entitled Cervical Cancer and the African Woman. So, to start off, we're going to briefly go over what cervical cancer is. So, cervical cancer, or any cancer for that matter, is just an abnormal mutation of cells on the body. So, in this instance, we're talking about the cervix. The cervix is located between the vagina and the uterus, and cervical cancer is typically detected via visual test or microscopic test, which is done through a pap smear. It mainly affects women between the ages of 25 to 45, and there are currently 100 strains of known HPV, which about 13 of those lead to cervical cancer. Many sexually active people will develop HPV at one point in their life, and HPV leads to cervical cancer in some cases, but many of those people will never go down the road of developing cancer because the body's natural immune system typically fights HPV off. In women who are immunocompromised, like for instance HIV or other medical issues, they may actually develop cancer. So, what are the symptoms of cervical cancer? Early on, many women don't have any symptoms at all. And they're just going in for their routine pap smears and things like that. But early on, if a woman does have symptoms, some of the symptoms may be pain during sexual intercourse, and like I had mentioned earlier, an abnormal pap smear. Some of the later symptoms, which is usually what women exhibit, are heavy vaginal bleeding, primarily after intercourse, abdominal bloating, and rectal pain and bleeding upon passing bowels. And usually at this point, it has metastasized, meaning that it has spread. So, this is why the prognosis for cervical cancer is so poor, is because once a person is having symptoms, they're usually further into the disease. So this is just the image to show the progression of cervical cancer by stages. So you'll see the first image is a normal cervix, nice and healthy. And as you go on, you'll see the redness, which is indicating the cancerous tissue, spreading up and up and up. So usually by the end stage, a person will definitely have symptoms because it's already spread out of the cervix. So how does it impact the African woman? WHO, World Health Organization, estimates that there are about 68,000 women, African women, diagnosed with cervical cancer each year. These estimates are very modest because due to certain constraints, it's difficult to get accurate information on the continent. In Africa, 34 out of 100,000 women are diagnosed with cervical cancer, and 23 out of 100,000 will die as a result of disease progression. In comparison, North America, 7 out of 100,000 women are diagnosed with cervical cancer, and 3 out of 100,000 will die as a result of this diagnosis. Again, women who are immunocompromised, such as women who are HIV positive, will definitely have a poor prognosis with this. And there are also high HIV rates in many countries on the continent. So, just for perspective, in 2008, there were 5,250 cases of cervical cancer in Kenya. And as a result, 3,286 deaths. We're talking about 9 deaths per day of a totally preventable cancer. So this really puts things into perspective when you want to talk about comparisons and how many people are dying per day. Since images do work better with some people, these are cervical cancer deaths in 2018. So you'll see African continent is huge, not a country, it's a continent comprised of 54 countries. So the countries in darker purple are the higher rates of cervical cancer deaths. And that's typically sub-Saharan Africa. So we're talking about Malawi, we're talking about Zimbabwe, we're talking about Kenya, Tanzania, those countries. So you can see that the mortality rate is a lot higher in those areas. In Northern Africa, it tends to be on the lower side. It's still high compared to other parts of the world. So you can see in North America, it's very low. Even in Far East Asia, it's low. Parts of the Middle East is low. Europe is low. So the African continent has very high rates of cervical cancer and cervical cancer leading to deaths. So, what are some of the barriers that African women face when it comes to even diagnosis of cervical cancer? Because keep in mind, like I had mentioned earlier, if you catch this cancer early, it's very easy to treat. It only has poor outcomes when you go further into the disease. So, some stigmas around it are discussing sex openly. Many African cultures and customs, you don't really discuss sex like that. So, people are not really open with sex education. Mistrust of the medical system and Western doctors. Many women have the fear of having their wombs removed, thinking that if they come up positive, that it'll just be an automatic hysterectomy. Belief that cervical cancer is tied to witchcraft. There's also inaccess to vaccinations, and even if there are access to vaccinations, there aren't any follow-ups. And also limited resources due to inadequate access, and the effects of colonialism and war continue to ravage many countries in Africa, leaving the most vulnerable, women and children, at risk of developing preventable diseases. So, how can the nurse um, help with this, and what is her role? So, levels of prevention primary would include sex education, community outreach, and encouraging the HPV vaccine. Secondary would include screening patients such as pap smears, ensuring that women get tested based on updated guidelines. And tertiary, once the woman is actually diagnosed with cervical cancer, that would include cryotherapy or large loop excision to limit cancer progression. At that point, you want to limit it. Most of these can be done outpatient if there are adequate resources. I have to stress that. And doing it outpatient, if that is available, would increase adherence and limit patient costs. Some community initiatives and nurse role. Primary nurse always, and I have to stress this, needs to ensure that there's culturally appropriate education. Because if there is not culturally appropriate education, then the education is essentially pointless. So the nurse can do that by educating and recruiting community members who will go into those communities and educate their people. You also want to build a relation with the local country's health ministry. That's great, so they can include the HPV vaccine on part of that immunization schedule. Rwanda did that, and they're having some great results. Currently, there are only 10 African countries out of 54 that include the vaccine within their schedule at this point. Building trust is imperative as well. Secondary, setting up appropriate private centers for pap smears, screenings, free condoms, enforcing the importance of adhering to checkups every year or based on updated guidelines, which is every 5 and every 10 years. Tertiary, keeping costs low or free for diagnosed patients with limited or no income, and making sure services remain outpatient so there is compliance. These are currently the 10 countries that offer the HPV vaccine. So, screening for cervical cancer and consequences. Encouraging vaccines among girls to prevent the spread of HPV. This starts young. So, there are many rumors about the vaccines, and a lot of people remain weary. Like I had mentioned, Rwanda is one of the first countries to implement this, which is great, and they're having excellent results. Due to limited resources in poor countries, cervical cancer among women, African women, are detected at late stages. Again, that's why the prognosis is so poor. So, as a result, WHO recommends testing women between 30 to 49 years of age. Cancer rates still remain high despite these attempted screenings. So there are several ways to test: the HPV DNA test, visual inspection, and pap smears, which is the most known way to test. These tests are cost efficient, they get quick results, and you allow a patient to receive treatment if anything comes back positive. Limited resources for screenings in poor country pose a great challenge. Thankfully, women who have tested negative need only to be screened every 5 years, but they need to be rescreened within 10 years per WHO. So, depending on the type and stage of cervical cancer, once it's diagnosed, it can prove costly to get chemo or radiation, even in developed countries. So, if we're talking about many African countries, if you even have access to chemo and radiation, it's still difficult to get those services. So, it's really important to catch this very early on to have the best prognosis for an African woman. And if you start young and if you start the education young, it can have some really great results. Thank you for watching my video.